Hello, my name is Chalit Hodaguda. I'm a respiratory physician in Western Sydney and I work with Complete Health Australia. I would like to talk to you about asthma. Now, asthma is an area of special interest for myself and I run a severe asthma clinic in Western Sydney. Asthma is a very common condition in Australia. In fact, Australia is one of the countries with the highest prevalence of asthma in its population. Asthma is a very interesting condition in that it's a condition where the body's immune system gets confused, as I like to say, and starts reacting to things that it should not be reacting to, things it should be ignoring, and it starts to mount an immune response to these harmless things. Classically, glass pollens, dust mites, animal dander, mold, etc. Sometimes even cold air can set the immune system up. Now, the immune system is present along our airways because the lungs, unlike other organs such as the heart or the liver, is exposed to the environment. All the dust and pollution that's in the environment, we breathe deep into our lungs, and the immune system is present there to defend against things that should harm it, such as viruses and bacteria and so forth. In people with asthma, this immune system becomes confused and starts to react to harmless things, like I mentioned, such as glass pollens. When it does get activated, the immune system then causes inflammation, which is activation of the immune system, which results in bronchospasm or bronchoconstriction, which is narrowing of the airways. When our airways get narrowed, the resistance to breathe air through our airways becomes much higher, and the muscles of breathing have to work much harder. Our diaphragm and our chest wall muscles are then working harder to move air into and out of our lungs, which then causes muscle fatigue, and the muscle fatigue then is perceived or felt by the brain as shortness of breath, as chest tightness, as discomfort in the chest, which is what people with asthma complain about. Often asthma will also cause a cough as well, and it might be a wheezy, mucousy cough. Now, the diagnosis of asthma requires a lung function test, a thorough, clear history, and this can be done at Complete Health Australia. We sometimes do blood tests to look for allergies and for other markers of abnormal inflammation, and that's done through Complete Health Australia as well. Once we have our history and our lung function test and other investigations, a diagnosis of asthma can be made. Now, in the past, the cornerstone of the treatment of asthma was the inhaled corticosteroid, or puffers as we call them, and this remains true today as well, though we have a whole new array of treatments available as well, which are called biological agents. So biological agents are very specific treatments for specific types of asthma, and they are very, very effective in controlling someone's asthma, making them feel better, reducing the number of times they get sick from their asthma. Now, if you think you might have asthma, or if you'd like some help with the management of your asthma, I would be more than happy to see you at Complete Health Australia in Western Sydney. Thank you.